What's going on, everyone? Happy Tuesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I really hope you have a full and speedy recovery with no long COVID issues. It is time now for the Tuesday edition of the Pandemic Update for Tuesday, June 18th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Today is what I would consider to be a very busy news day, but you're not going to hear much of any of the news I'm about to report on your daily news report on TV. Why? Because, well, they stopped reporting on the pandemic. They've stopped reporting on a lot of these viruses. You hardly hear anything about what's actually going on. Well, that's my job. I come here to give you an update every day. If you want to stay informed, subscribe down below. Give this a thumbs up. Hit that notification bell. Leave a comment down below and share this with anyone you know. Alright, as stated, today is a busy news day, starting off with H5N1 bird flu, found at 5 more dairy farms, including 3 in Minnesota and 2 in Iowa. And you can see here the map continues to fill in, and we haven't added any new states today, but for the states that we do have, the numbers have been increasing. Alright, COVID outbreaks. There is one up in Canada. COVID-19 outbreak declared at Riverview Manors Ocean View household in Montague. So yes, COVID, it's still a thing. Outbreaks up in care facilities continue to happen, and we have another one now. This time it's in the Dublin Hospital over in Ireland. Dublin Hospital closed to visitors amid surge in COVID-19 and norovirus cases. So yes, it does continue to spread over in Ireland as well. Moving on to this from the World Socialist website, WSW.org. Infectious disease skyrocket worldwide fueled by COVID-19 pandemic. Diseases, they've been going up. We've seen a lot of different things. Ever since the pandemic started, we've seen other viruses pop up now, especially deeper into it, because when COVID vaccination started, there was many that chose not to get it. Well, they didn't only choose not to get the COVID vaccine, they chose not to vaccinate their child for other viruses, and, well, other viruses are starting to spread. And in some cases, there have even been breakthrough cases of some of these other viruses. And then there's other reasons. Long COVID. People who have long COVID, some of them constantly are getting sick again and again. Chris Cuomo just stated on News Nation last night. Yet again, he is sick. And who knows how long that will last for him, because he has long COVID. Moving on to this now. Months after being diagnosed with COVID-19, 1 in 5 people are still suffering from symptoms, new research finds. Yep, it's very true. A lot of people still suffer from symptoms down the line. Probably the most common one that I hear about, cough. A lot of people have lingering coughing after COVID. Moving on to our next story. Stevie Nicks had to postpone a concert due to an illness in the band just before showtime at Hershey Park Stadium. This is in Hershey, Pennsylvania. So yes, this happened last Saturday night, I believe. Yes, we're late to get into this one. Saturday night, she had to postpone her concert because of illness. All right, taking a look at today's pollen levels. Drum roll, please. Let's refresh this. 36% of the country is in low to medium status. You can see there is more green now. But we're still seeing orange out here in Oregon and Northern California, some orange in New England today, and even parts of the Four Corners region. The Southeast seems to be doing the best for pollen levels today. All right, air qualities. They're not great for a lot of people. We have this huge heat dome, this huge heat wave. It's causing all kinds of problems. Take a look at this. You can see here from the Southeast all the way into the Northeast. I mean, Florida's fine, but then you get up here to Virginia, Pennsylvania, Massachusetts, New York State, New Hampshire, Maine, Vermont, Connecticut, Rhode Island, Ohio, Indiana, Kentucky, all seeing bad air quality today. Please limit your time outside if you're in these areas, because not only do you have the bad air quality, you also have the hot temperatures as well. In California, there are wildfires ongoing now. It's going to be dry there for several more days. Next 7 days doesn't show much of any precipitation, so this wildfire situation out there might get worse. Heat-related illnesses. This map is really going to start to fill in next week because of how hot it is now in the east, and that is going to remain intact. But the West Coast is even seeing heat-related illnesses as well. All right, moving on now. You can follow me on another source on X. Climate Data Report. You can find out all about weather, and you can also follow me on my other YouTube channel. Let's refresh this so you can see that we did today's video. And it's basically about watching tropical systems under the heat dome. Yes, there's some activity now in the Gulf of Mexico underneath this big heat wave. All right, moving on. Philadelphia yesterday. 850 EMS calls, much higher than Sunday, and I think that's going to be the case throughout the week. Wait until you see what's going on in surrounding counties. All right, here's Montgomery County. We see not one, not two, not three, but 4 cardiac emergencies and a few other mixed in calls. But now we got to go over to Chester County. Yeah, take a look at this. Chester County is absolutely slammed right now. Emotional disorder, heart problems, heat-related call right there. Exposure to heat, injured person, respiratory difficulty again, heart problems, someone having a baby, fall, lift assist, hypotension, sick person, diabetic emergency, sick person, heart problems again, back pain, and I think we just added, yep, another heart problem just popped up here. Wow, really busy in Chester County, Pennsylvania right now. Taking a look at this week's update from Walgreens, and we can see here the national positivity rate for COVID. It continues to rise. It's at 30%. The prior week was 27.1%. It is up by 2.9%. Again, not a lot of testing. 4,366 tests versus 4,213. Yeah, that's up from last week, but there's millions of people that live in the United States, and we know hundreds of thousands of people are testing positive every day, but hey, a little increase is better than no increase. Let's look at a few states. Tennessee this week, 27.2%. That's up by 5.3%. Last week was 21.9%. Total test, 103 versus 128. Let's come down to a state that's actually in the green, and that would be New Mexico. New Mexico, 22.6% this week. The prior week's COVID positivity rate was 25.9%. That's down by 3.3%, and testing's up, 31 versus 27. Louisiana this week, 34.8% positivity rate. Wow, this is really bad. 21.4% last week. That is up by 13.4% with testing up a decent amount. 46 versus 28. Let's stay in the South. Mississippi, because we don't usually talk about Mississippi that much. We need to talk about Mississippi. 29.4% this week, 35.3% last week. Difference of down 5.9%. Total tests remain the same. Let's go to your next door neighbor, Alabama. Whoa, this is not good. Alabama, 30.3%. The prior week was 16.2%. That is up 14.1%. Total tests, 33 versus 37. Yeah, testing's down slightly, but that doesn't justify a rise that big. A rise in cases does. And let's just go to your next door neighbor, Georgia, 29.2% this week. The prior week was 23.5%. Difference of up 5.7%, and that's with testing up. 195 tests versus 149. Again, you're seeing a rise as well. Minnesota, also seeing a rise. 27.8% positivity rate this week. Prior week was 17.4%. Difference of up 10.4%. Yeah, testing's down by 10. 36 versus 46. I think there's also likely a rise in cases there. Ohio is seeing a rise as well. 25.4% positivity rate this week. Prior week was 22.1%. That's up 3.3%. 67 tests versus 68. Just one less test. You're seeing a rise in cases, and your state reports have noted that as well. All right, let's end up here in Oregon. Oregon this week, 31.3% versus 38.9%. Difference of down 7.6%. And less testing, 16 versus 18. So good to see Oregon down. We may take a look at a few more of these states again tomorrow. Now let's take a look at some wastewater data, and we do need to refresh this. Yesterday we ended off in Belmar, New Jersey, and today we're going to take a look at a different area. And today we'll go to the nationwide level. Let's see what nationally is doing here. Mind you, I am just refreshing this. Okay, looks like nationally, though we were rising, starting to level off, and maybe a little bit of signs of dropping for COVID. RSV at this time is flat. Influenza A dropping. Influenza B dropping. HMPV dropping. Norovirus medium, but still dropping. And the other ones, we don't look at the other ones. And now let's go to the Midwest region. What's going on there? Midwest is flat at this time. Just a little bouncing around, but overall flat. That's good. We don't see it rising. We don't want it to rise. RSV at this time is dropping. Influenza A is dropping. Influenza B is not much of an issue at this time. HMPV dropping, and norovirus is medium, almost low. How about COVID in the Northeast? In the Northeast at this time, I'm seeing a rise once again. Northeast has been bouncing around, but now this is a little bit more of a significant rise on the most recent update for COVID. RSV is flat at this time. Influenza A has rose slightly, and Influenza B is flat at this time. HMPV dropping. Norovirus is also dropping, but in medium at this time. Moving on to the South. In the South, we do see there is a rapid rise, at least on the most recent update. It's detecting a rapid rise for COVID at this time. Look at that. That's straight upward. But we know that's going to correct. We've been watching this happen in various different places. The West Coast did this, but either way, even if you correct that, just say just a little bit less harsh. That's still a pretty significant rise. RSV, slight rise at this time. Same with Influenza A. Influenza B, no rise. Dropping for HMPV. Norovirus is still medium to high, but dropping. And now moving on to the West Coast. And when we take a look at the West Coast today, we can see here COVID showing signs of maybe a peak in the West Coast. It's dropping a little bit. That would be some welcome news. Taking a look at RSV is low, Influenza A is low, Influenza B is low, HMPV is dropping, norovirus is still medium, but it's dropping and almost into the low category once again. Alright, drum roll please, we have to refresh Canada. I don't know if this updates every day. Let's see here. Number of sites showing an increase for wastewater for COVID in Canada, 14. Number of sites showing no change, 39. 12 are decreasing. 1 site is high, 8 are moderate, 14 are low. New sites, 42 at this time. All right, taking a look at this, I want to show you this. Emergency department visits for COVID, percent change. And you can see there are substantial increases in Vermont, Rhode Island, New Jersey, Delaware, Virginia, West Virginia, Indiana, Illinois, Iowa, and in Nebraska at this time. And there are moderate changes in many states such as Texas, Florida, Georgia, South Carolina, North Carolina. Pennsylvania is moderately increasing now. Ohio, Maryland, Massachusetts, Montana, Washington, Utah, and even in Colorado showing moderate increases. Some places are flat, and places like Maine and New Hampshire actually dropped a little bit at this time. Even in Connecticut and in Kansas, a small drop at this time, so that's good to see. All right, moving on now to some more data, and let's take a look at this. Epidemic status is increasing in a lot of places here in the United States. It's definitely growing in the South at this time. I just showed you some data from Walgreens that says, hey, positivity rates are rising, cases may be rising once again, but we're down to likely growing in Hawaii. I hope we can report on that Hawaii is going to peak relatively soon, because let's go back and take a look at this once again, and I want to show you Hawaii. Here it comes. And take a look at this. If you're new to my channel, maybe you never saw this before, hopefully it will come up. Hawaii's emergency department visits have been rapidly rising. And here it is. Check this out. Yeah. Ever since about April, their levels have just been skyrocketing. It's one of the biggest waves they've had in a couple years. And you can see here, there are a huge number of people that have been going to the emergency department. 5% of emergency department visits are now for people diagnosed positive with COVID in Hawaii. Alrighty, moving on now. The latest variant of COVID is the KP.3 variant at 25%. KP.2 is at 22.5%. And the variant that caused trouble back during the holidays of the winter and the winter wave was JN.1. That's now down to 3.1%. We will get a new update on these variants on Friday. Moving on now to the weekly influenza map. Yes, let's take a look at this, and we can see minimal activity out to the west, and I don't think anywhere is in the low category. So everywhere, for the most part, is now in the minimal category. Puerto Rico's minimal, although I should note with Puerto Rico, as for COVID, your levels are rapidly rising at this time. And I thought I had Puerto Rico up here. Now I don't. We got to get their dashboard up there, because I did find that they still do have a dashboard. All right, speaking of rising, New Jersey today. Not all the hospitals reported. 67 out of 70. Which is it's close to about the maximum. I don't think we've seen 70 out of 70 in a while. We've seen 69, but it's up to 219 hospitalizations, 7 people on a ventilator, discharges 23, in the ICU 29. So again, with 67 out of 70 hospitals reporting in New Jersey, you have 219 hospitalizations today. New York State, another 826 cases. You can see here, clear as day on the chart now. They continue to trend higher. There was no peaking recently. They continue to trend higher, and the hospitalizations are responding to this as well. Take a look here. Pretty big jump in hospitalizations today. Yesterday was 585. Today is 634 with 46 people in the ICU. But I do want to remind you of something. Let's zoom this out for a second. Let's zoom this out and I'll show you something. This is relatively low compared to where they were in the wintertime. You can see we're all the way down here, 634. In the winter, they peaked at 3,403. But just be mindful, they are rising at this time. And again, this is probably some of the lowest levels that we'll see for the rest of the year. You can see last year, they rose in the summertime. They went all the way up to 1,711. They started off at around 388. They went up to 1,711. But then when they dropped, the lowest they got was 1,063. And it was only up from there. And then it really went up around the holidays. So that's been the trend of what happens with this virus. The lowest levels of it are in the spring to very early summer months. And then they rise, then they peak, and then they rise again even higher. That seems to be what has been happening. And New York City is also still seeing a rise as well. We can show that to you right here. 296 people in the hospital there versus 286. Not as big of a rise as the statewide level. And hospital admissions, not only in New York City, look at that. Big increase for hospital admissions. They had 108 reported last week on the Tuesday update. This week it's 144. And if we look at the statewide levels, you can clearly see here in New York State, the hospital admissions, they are starting to trend higher once again. Alrighty, folks, that does it for the Tuesday edition of the Pandemic Update. We will have another Pandemic Update again tomorrow, like we do just about every day. And if you like this update, give it a thumbs up. Want to see more content like this? Subscribe to my channel down below. Of course, share these videos with anyone you know. Hit that notification bell. Leave your comments down below. And I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Tuesday afternoon. Thanks for watching.